This is Dr. Murali Mohan. I am the Senior Consultant Pediatrician and Neonatologist at Joshna Hospital, which is located on TC Palya Main Road, Bangalore. If we go to a non-infection causes where you should have hospital visits regarding kids, again we go by systems. If we say respiratory, the very common reason we see is foreign bodies, like young kids keeping some eraser pieces or parts of soft toys, these kind of things into their nose. And even some kids we see like peanuts or some dry fruit pieces, and these will go unnoticed in children or unnoticed by the parents, because we won't be having a round the clock or 24 hours monitoring for the kids, because they'll be playing at the corners, and if they find something and they can keep in the nose. Foreign bodies are very common. And other thing is epistaxis, which in general to say it's like bleeding from nose. Again, it can be a spontaneous epistaxis or a traumatic. Traumatic, you will be witnessing the trauma and immediately you will visit the hospital. Spontaneous also, it can happen at any point of the time, and most of the time spontaneous epistaxis is self-limiting, and the reasons are, we say, idiopathic. There won't be any reason, and as the child grows, they grow out of it. But traumatic epistaxis, if the bleeding is profuse or more, you should have a hospital visit to control the bleeding. Again, if you come to GI related non-infection causes, again the most common causes is like gastroesophageal reflux in younger children and gastritis in little elder children, mainly because of their changed lifestyle or food style, having lot of fast foods, junk foods, and improper timing of food habits. And again the other thing is constipation. Constipation we see very regularly in our OPD visits, and most of the times in younger children or school going children it will be most of the times functional, but if it is not addressed properly, or if you have not taken a pediatric opinion regarding this, it can lead to further complications like piles and fissures, which will require surgical corrections. And coming to the next system, if you heart, most of the times we don't see any infection causes in the heart, because to develop some infection in the heart should have already an insult, which can be a congenital heart diseases. And kids with congenital heart diseases, they can have they will be at high risk of infections. And the non-infection visit for heart diseases to see how the disease is progressing, whether the child requires any surgical correction for that. And if in case of brain or central nervous system related visits would be commonly head injuries. Like we see many kids falling from the bed, sofa, or from teapots or from the tables while playing, or in the playground when they're playing, a ball would have hit them, or they would have had a fight or quarrel with the other kids, and they can have this, and this could be the reason for hospital visit. And skin related non-infection causes are like, again, rashes. Most common skin rashes which are not related to infection in kids are like allergic rashes, which we call urticaria. And if you have vicinity, if in your vicinity if you have more of mosquitoes or other insects, it could be a mosquito bite allergy or insect bite allergies. And some kids will have some patches from their birth onwards, or they would have developed these patches in the early ages, and these also needs to be witnessed by the doctors, because these can be a clue for some other diseases in the body. And some growths, like some kids will have skin growths like warts, which has to be removed. Thank you.